elect on single payer in New York is here back here with us. He's got to go vote, so come on up, Eric.
Thank you very much.
You're welcome.
Good afternoon. I know you can hear me, and I can hear you. And if you make a noise loud enough, every single congressman on this hill will soon hear all of us. And she is a national chairwoman of Progressive Democrats of America and was a charter member of Artists United to Win Without War, a leading supporter of Dennis Kucinich's anti-war presidential campaign of 2004. She has worked on human rights, environmental, and labor issues. She gives selflessly of her time and energy to advocate for guaranteed health care for all. Please welcome Mimi Kennedy.
Thank you very much, Michael. Thank you, nurses. You know, when you came rolling into the park, I understand why you guys take our pulses and understand our heartbeats. A boom, 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 boom. You nurses are on the move, and you know how they say somebody has their pulse on the finger of the American people? Well, guess what? Literally, you do. And when they say American people don't want single-payer health care, yes, they do.
Thank you all. Thank you all for being strong trade unionists and standing up for workers' rights all over the area. Let me tell you why I'm so glad to see you here, because you can't see it, they're kind of invisible. But all over this place, there are thousands of lobbyists representing greed and short-term profits, and it's nice to see ordinary people coming here to Washington fighting for the rights of their patients and all of our people. I don't have to tell you because you do the work every day. Our current healthcare system is disintegrating. We need a new system. And what we need is a system not based on the profits of the private health insurance. We don't need a system mired down in bureaucracy and waste. We don't need a system where CEOs earn all kinds of outrageous salaries. We don't need a system in which companies are paying out huge profits to their stockholders. What we need is a single-payer national health care system. We need a system that works for Americans, providing quality health care to all of our people, comprehensive health care to all of our people in a non-profit way. Now, this system is so wasteful that we end up with 46 million people with zero health insurance, even more who are underinsured. Healthcare costs are soaring, and at the end of the day, we end up spending twice as much per capita on healthcare as any other country on earth. That doesn't make any sense to me. And on top of that, our healthcare outcomes in terms of longevity, in terms of infant mortality, in terms of dealing with chronic diseases are in many ways worse than other countries that are spending far less. We do not need to spend any more money on healthcare. We need to get it right. Instead of profits for health insurance companies and the incredible bureaucracy by which they drive all of our people crazy with unbelievable ideas like pre-existing conditions. What insanity is that? What is an insurance system for if not to help you when you need it? And they drive people crazy when they call up and they say, oh, you thought you were covered for that procedure. Guess what? You didn't look at page 63. You're not covered. Well, we've got nurses all over America who want change. What you were educated to do is provide care to your patients, not fill out forms. Is that right? We've got 15,000 doctors supporting a single-payer system, more than any other approach. So what we have got to do is take on the big money interest in the insurance companies. We've got to take on the drug companies. The drug companies were driving our people crazy, charging them the highest prices in the world. And we have got to move toward a single-payer system by rallying the American people. So that's where we are today. And I just want to thank you for being here, and your presence here is representing millions of people who say we need fundamental changes. We need to lead the world in making sure that every man, woman, and child has comprehensive health care. Not high deductibles, not high co-payments, not high premiums, but that health care is a right, not a privilege, and we're going to fight until we achieve that goal. Thank you for what you're doing.
My name is Ann Boer, and I'm a physician from Columbus, Ohio, with SPAN and with PNHP, and we need to get our representatives in Congress to get a single payer now.
We're going to keep building the movement and push until it's done. So, thank you.
What we did is we signaled to the Senate Finance Committee, who's writing healthcare legislation, that nurses and doctors will not go silently, though they will make a silent protest, against not having a policy debate on the merits over single payer. And that we basically sent a message to Senator Baucus that people will escalate and engage in civil disobedience if their democratic rights are not heard and if the majority support for single payer is not reflected in the Senate deliberations. And we secondly had a breakthrough meeting on the House side with the majority leader, where we made it clear that that the House needs to have a policy debate on the merits, joined by members of the Progressive Caucus who stood up because of PDA, because of our leadership conference for guaranteed health care, and said that the House has to include single payer, and the advantages of single payer have to be understood, and that Chairman Conyers has to be a central part of the debate on healthcare policy in the House, and that the committee chairmans need to recognize that Democratic voters, support single payer, and that they are at risk if they alienate their own constituency. And PDA brings that message home very clearly, because you're in the streets and you're meeting with these folks and you're mobilizing Democrats to hold Democrats accountable to the Democratic position.
For single payer, we want you to call your representative and say you want 676 single payer health care now. That kind of pressure is the only clear thing that lets them know they can't get away with what the insurance companies want. That's the only way that they know that Obama will have the support of the American people if they go for single payer. And that's the immediate action on health care. And the long-term action is stop just reading and reacting to the newspaper, or listening to the radio or the television. They're not in charge of our government. You are. And with each other, if you find a pipe that you can go through that gets you into your government, you go through that pipe. PDA has laid the best pipe I know.